Hi, my name is Giulia Corradetti. I'm a clinical instructor at UCLA and a scientist at Doheny Eye Institute. I'm very happy to have the opportunity to present my work at ARVO in Denver this year. And the title of my presentation was Baseline OCT Biomarkers to Predict Response to Treatment in Eyes with Neovascular AMD treated with faricimab as part of the TRUCKEE study. The TRUCKEE study is a study led by Dr. Kanani. It's a multicentric study collecting OCT imaging from different centers. In this specific analysis of the TRUCKEE studies, we aimed to study and assess the baseline OCT biomarkers in eyes treated with at least 3 injections of faricimab, and we studied the relationship between baseline OCT biomarkers and the response to treatment after 3 injections of faricimab. The scope and aim of this study was to assess why some of the eyes treated with faricimab did not achieve a optimal anatomical response. And we found that eyes that at baseline had a greater RPE disruption or attenuation were associated with increased persistent residual IRF after 3 injections of faricimab. As well, eyes with larger and wider and taller PED at baseline had a greater PED volume burden at follow-up. Regarding the persistent SRF fluid at follow-up, the greatest driver of that was the greater SRF at baseline. So I think these are very compelling results that could help us to stratify the response to treatment and consult better patients in our clinic setting. Our results were pretty strong, I think, because RPE disruptions have a greater RPE disruption at baseline. It might be an indicator that that those eyes probably have a more advanced stage of the disease, and not all the intraretinal fluid, probably it is exudative. There is partially component that is non-exudative as well. For the taller and wider PED, probably those has been published before indicate have been described in association with non-exudative fluid and may not be fully fibrovascular PED, might have a component that is not fibrovascular. Well, I think that understanding better the baseline phenotypes of eyes with, in this case, neovascular AMD certainly helps in the risk stratification. It helps understand better why a subset of the population does not achieve an optimal anatomical response, and probably it is very important to inform future clinical trials and to optimize the design of clinical trials for future treatments.